So good evening, everyone. And thank you, Ms. Trico. We want to say thank you to you all for the invitation as well. It's always a privilege for us to be able to share or give an overview of the NHI Bahamas plan. So we welcome the invitation. And so as introduced, my name is Tanisha Pinder. I am the Benefits and Enrollment Supervisor at the National Health Insurance Authority. Joining me on this call, I have Ms. Chandra Sawyer, who is our wellness specialist. And after my presentation, she'll be sharing some wellness tips with you. And I also have Ms. Denise Higgs, who is our administrative specialist in the Benefits and Enrollments Department. So we're going to go ahead and get started. So I'll share my screen. Tell me if it's sharing.
It's loading, yeah.
Okay.
Okay, yeah, we can see the presentation.
Okay, perfect. So the question was asked, why is access to healthcare important? Well, approximately 70% of Bahamians do not have health insurance. So that leaves the majority of us without insurance coverage. That means the majority of us are trying to access healthcare through the public system, which is our public clinics or the emergency rooms at the Rand Memorial Hospital or PMH, which creates bottleneck in our public systems. Health insurance is extremely expensive, not affordable for many, right? You have the average person paying some $500 per month. And that's someone who's probably in good health, right? Not too bad, average paying 500. Those persons who have very serious underlying issues can average insurance coverage, can average between $1,000 to almost $1,500 per month for those persons. We also have persons, Bahamians avoiding medical visits and treatments because they're worried about the high out-of-pocket costs, right? And so they can't afford insurance and they're worried about how am I going to pay to access good quality healthcare. In 2014, the Bahamas ranked 6th as one of the most obese countries in the world. Reason being, diseases such as hypertension, diabetes, heart disease, strokes, kidney disease, cancers. So these are some of the major concerns right now here in the Bahamas. These diseases are amongst the leading cause of mortality and account for nearly 45% of deaths in country. Then when we look at poverty, areas of residence, these are persons on our family islands, language barriers and disabilities. These are some of the reasons why access to healthcare is extremely important. Ladies and gentlemen, if you just give me 2 minutes, the call that I told you I have an emergency call, just give me 2 minutes and I will get right back to you. Just give me a minute.
Oh, no problem.
Thank you.
So I'm sure, oh,
Go
sorry.
ahead.
No, I was just going to let the folks in the audience know that yesterday, Equality Bahamas ended it was the end of the global 16 days campaign to end gender-based violence against women. And we have recordings from those 16 days of events that were both virtual and in person on our YouTube channel. You can find those recordings at tiny.cc/16 days 4 recordings. And I think we have Ms. Pinder back with us.
Yes, I'm back. Thank you so much. Okay, so that's handled. Should be no more disturbances. And so, yeah, so these are some of the reasons why it was important to make access to healthcare available to all. And there you have the launch of the NHI Bahamas Plan. And so NHI Bahamas Plan is a government program that ensures that all Bahamians and legal residents, no matter their income, age, island of residence, or current healthcare status, can access healthcare at no cost at the point of service. So NHI is truly a Bahamian success story. In 2017, when launched, we launched with the promise of making the Bahamas a healthier nation. And we've had some significant results in the last 7 years. From our very first beneficiary in 2017 was a retired school teacher without access to private health insurance, yet still through NHI, she could access a family doctor and receive primary care services. So I want you to fast forward with me 4 years later. In 2021, we enrolled our 100,000th beneficiary, which was an 8-year-old boy whose father enrolled him into NHI to ensure that he had access to quality health care. So where is NHI today? I think I skipped one of my slides. Yeah. So I'm just going to go really quickly. And so our vision at NHI is we want to lead the way in providing access to affordable, quality healthcare that Bahamians deserve. Our mission at the authority is we want to transform the healthcare system upon which the future well-being of Bahamians depend by putting patients at the center of every decision that we make. We are passionate about bringing universal healthcare to all Bahamians. We are relentless in expanding access to quality healthcare through progressive solutions supported by technology. We are dedicated to delivering affordable healthcare through our partnerships with our providers, as well as our beneficiaries and all of our stakeholders. We are committed to doing business with integrity, accountability, transparency, and sincerity. And we're honoring our beneficiaries by providing care and respect in all aspects of the services that is offered through the NHI Bahamas Plan. So where is NHI today? Well, we are an organization that is deeply committed to leading the way in providing access to affordable quality healthcare that Bahamians deserve. So we spent a lot of time when we were envisioning our mission statement. And we wanted to underscore the fact that Bahamians deserve healthcare that is delivered safely, and that is affordable. So since the launch of the program, we've been working diligently to deliver on our vision and advance our pathway towards universal health coverage. So universal health coverage simply means that all Bahamians and legal residents will have access to quality healthcare services without financial hardship. So since the launch, we continue to experience high enrollment growth. We currently now have some 160,000 Bahamians and legal residents that have enrolled into the NHI Bahamas Plan. We also serve a diverse demographics of Bahamians. We've enrolled Bahamians from more than 17 islands, and this includes some 8,500 under the age of 5, more than 30,000 school-age kids, and some 20,000 senior citizens, and that's those persons over 65. So this proves that the NHI Bahamas Plan is available for the young and old alike. There are no restrictions or limitations for individuals to enroll into the program. We also continue to experience high patient satisfaction. Our last survey held in 2022, 96% of persons surveyed and enrolled said that they were satisfied with the services that they were receiving from their current primary care providers. And this is especially important to us at the authority. So beyond ensuring that we make access available to patients, we must hear about their experiences. We want to make sure that our beneficiaries are not only accessing services, but also accessing them in a satisfactory manner. So we want to hear from our beneficiaries. We are currently now in the process of our 2024 survey. We started in July, and we're going to end sometime in the new year. So we'll have the new statistics, and we're hoping that those numbers would increase or at least remain the same. We also have an expansive providers network. Today, there are 137 physicians private physicians currently under the NHI Bahamas plan, and these are spread across some 89 primary care facilities. We've also partnered with 19 major laboratories, and I'll just name a few for you that are familiar. You have Doctors Hospital, Bonaventure Lab, Premier Lab, Oak Tree Lab, and Family Medicine Lab, right? And these are all extended across 9 family islands. So currently we have facilities in 9 of the family islands. They are Abaco, Andros, Bimini, Cat Island, Exuma, Eleuthera, Grand Bahama, Long Island, and now here in New Providence. So just a point to note, we continuously seek opportunities to expand our network of physicians within the family islands. Our goal is to reach other islands outside of the 9 I have mentioned. We want to ensure that we have a footprint or representation throughout our archipelago. Also, we've enabled digital care for our beneficiaries. So we have significantly invested in technology. So in November 2019, we've decided to digitally enable our care by launching the electronic health records. Simply put, we took the paper records and digitized them. So all doctors now have digital records of their beneficiaries' medical history, allowing them easy access. Also, as a part of this digitally enabled care, our beneficiaries now have access to a patient portal where they can access a summary of their medical history, lab results, prescriptions, and health education services. Advice, sorry. Also, as a part of the EHR, there is a feature known as telehealth. So telehealth is simply using technology to bridge the gap related to the delivery of care. For example, telehealth allows a physician to activate a telehealth call using a secure Wi-Fi connection with a patient anywhere in country. So we saw the benefits of this definitely in COVID and the COVID environment, as we could quickly activate the telehealth capabilities for our providers to connect with their patients. And it also makes it easy for our beneficiaries on those family islands where there are no NHI facilities. This telehealth feature definitely comes in handy for those persons. So. So we are building upon the significant accomplishments that we've achieved within the authority over the past 7 years. Our expansion plan is being implemented in a phased approach, allowing us to gradually enhance the benefits we offer as the program continues to flourish. So at present, under the NHI Bahamas plan, our beneficiaries enjoy access to a variety of primary care services. These services include unlimited general sick visits, a wide range of laboratory testing, and comprehensive care packages for both pediatrics and maternity patients. Additionally, we place strong emphasis on health education, providing valuable resources that cover healthy living advice, wellness programs, and educational incentives designed to promote the overall well-being of our beneficiaries. So looking ahead, we aim to broaden our scope of primary care coverage significantly. Our future offerings will incorporate essential diagnostic imaging services, including X-rays and ECGs and ultrasounds. Also recognizing the pressing health concerns within our country, we are committed to implementing cancer screening programs that are vital to early intervention. These will include essential services such as the mammographies and colonoscopy, alongside our existing offering of the PSA testing and the pap smear. So we are looking to add these additional benefits as we continue to grow this plan. These are the benefits that we would love to be able to add as early as 2025, 2026. And so the expansion of these benefits will enable us to establish a more comprehensive network of care for our beneficiaries. This initiative will not only enhance the quality of services provided, but will also ensure that patients in our healthcare system can access necessary care without facing any financial barriers at the point of services. So by prioritizing these advancements, we are dedicated to creating a healthy future for all Bahamians and residents of the Bahamas. So let's look a little bit at our benefits in detail. So under the current NHI package, as I said earlier, our beneficiaries are entitled to primary care services. And this includes unlimited general sick visits or general visits with their primary care provider. So which means if you're not feeling well, you come down with the flu, you can call, make an appointment, book your NHI with an appointment with your primary care provider under NHI, and you're able to see your primary care provider at no cost at the point of service. The majority of our facilities go by appointments only, with the exception of the Medic Center, which is a walk-in clinic. Also, a few of our facilities also have walk-in days. So that's a conversation you will have to have with your facility to find out what those days looks like. And also, like I said, the majority will go by appointments. You're also entitled to the annual physical. So the full annual physical is covered under NHI. And this includes all of the lab tests that is associated with the annual physical is covered under the NHI Bahamas plan. We also cover the maternity care. So under our maternity care package, the expecting mother is entitled to the pregnancy test, 7 to 9 prenatal doctor visits with her primary care provider. So currently, we have about 8 OBGs that are currently under the NHI Bahamas plan. So even if you are registered with a general practitioner or one of our family med doctors, you do not have to be reassigned to the OBG. You will then, your primary care doctor will then just refer you to one of our OBGs. So you will still continue to see your primary care provider for your primary care needs, and while having your maternity care under one of the OBG doctors. She's also entitled to all of the blood work that is also associated under the maternity panel, and also screenings for all genetic characteristics. We cover the pediatric care. Under our pediatric bundles, our infants are entitled to their lab testing, their growth measurements, immunizations, their regular checkups, as well as their general sick visits. So that's their 2 months, 4 months, 6 months, and so on. All of their visits are covered, as well as all of their immunizations are covered. We have several pediatricians under the program. So we ask our parents to please enroll their children under the peds. We prefer to have our infants registered under the pediatrician. However, the program works by choice, and you can decide whom you would like to be registered under or whom you would like to have your child registered with. We cover your primary care provider. Also, we look at periodic health assessments. That's for persons who may be experiencing some underlying issues or some NCDs. Like I said, the full laboratory testing is covered. We cover some 72 different laboratory tests. We also cover all vaccinations and immunizations is also covered for our beneficiaries. And the cancer screenings that I talked about as well earlier. Currently, we offer the PSA tests and the pap smears. We offer the full panel of HIV and AIDS tests, as well as the full STD screening. So all STDs are also covered under NHI. You are entitled to at least one screening per year. And then we have the chronic disease management that would be done by our primary care providers as well. And so these are all of the things that are currently covered under NHI for our adults. We have your annual physical. We talked about that. General sick visits. You have the prostate test, the pap smear, the full STD panels. We also ask our primary care providers to also make sure they're providing educational advice, as well as making sure that persons, have the full assessment of healthy lifestyle choices, including diet and exercise, to really have those conversations with their beneficiaries, right? And just counseling on how to reduce the risk of these disease that is so common in the Bahamas. And so this is what we would have spoke on. And so what is not covered under NHI? So currently under the NHI Bahamas plan, we do not cover overseas care. No dental, no vision, no medication is covered under NHI. However, we do encourage our beneficiaries to speak with their primary care provider, and if the primary care provider see the need, they will advise you to register for either the med plan at NIB or the prescription drug plan. So there's an application. Your primary care provider will then fill out that application for you. The application is then submitted to NIB, and they will see which one of the programs you will qualify for. But currently under the NHI plan, we do not cover medication. No emergencies are covered under the plan as well. When you look at heart attacks or broken bones, we say go to the emergency room, right? These are emergencies. The NHI is primary care services only. So anything, if you feel that you're having a heart attack, do not try to go to your provider's office. I would suggest going straight to the emergency room. Inpatient or hospital care is not covered under NHI. Surgeries, chemos, and radiations not covered. Rehabilitative care is not covered. Delivery of the baby is not covered under NHI. So we cover the maternity care for our beneficiaries, right? And so you have up until your eighth month with your primary care provider under NHI. Provider then will ask you if you wish to have the baby publicly or privately. If you choose privately, then that becomes an out-of-pocket cost to the beneficiary. If you decide to go public, then the provider will then have you registered at any one of the nearest public clinic in your area of residence, right? And then you would have to register. You have to have at least one visit at the public clinic, and they will give you the referral form to PMH maternity ward or the RAN hospital. You will then register yourself at the public clinic for the delivery of the baby. Like I said, if you go private, that is an out-of-pocket cost to the beneficiary. We are looking to try and close this gap to where our maternity beneficiaries are able to have immediate access to the maternity ward without having to go through the public clinic in order to be able to access it. And so we're looking to close that gap. We're working on that now. We also do not cover, currently, we do not cover the mammograms, ultrasounds, ECGs, the x-rays, colonoscopy, MRI, CT scans. But as I said, in our expansion of our benefits package, we are looking to be able to add diagnostic imaging. That is something that we are currently pursuing. And we're hoping that we are able to add this benefits for our beneficiaries as soon as possible, but it is not a current benefit at this time. However, like I said, the program is being rolled out in a phased approach, and we are hoping to be able to add this additional benefits sometime in the early future of the program. So those are all the things that are not covered under the NHI Bahamas plan. So who can enroll into NHI? So to register for NHI, you just must be a legal resident of the Bahamas or have an NIB smart card. So those are the requirements. The program is open to all Bahamian citizens and legal residents of the Bahamas that have a valid NIB smart card. There are no age restrictions to who can enroll into the program. Once registered, you will select one of the primary care providers from the network of 139. Like I said, we have 137, primary care providers that spread across 89 private facilities, 9 family islands. So once you've made this selection, you now have access to your primary care provider. You have unlimited number of primary care visits, the annual physical, maternity care, the pediatric care. You have your full laboratory testing. Like I said, we have over 73 lab tests that is covered under the plan. There is no registration fee, no deductibles, no copays, no monthly fees. For the NHI Bahamas plan, there is no fees to register, no monthlies, no copays. And you can change your primary care provider for any reason. You relocate, you're just no longer comfortable with your provider. For any reason, you can choose to change your doctor at any time. So, how to enroll? So, currently, our online enrollment portal is currently down. The portal is being upgraded, and so that registration for the online portal is down. However, you can email us on info@nhibahamas.gov.bs, or you can just simply connect with us via the phone on 396-8500, where one of our benefits specialists will be happy to assist you. Or you can simply just visit our office on East Street and Purpose Way. We're open from 9 a.m. until 5 p.m. Monday to Fridays. Here we just have some tips that I always give to my new beneficiaries and even current have to remind persons that the NHI Bahamas plan was created for preventative care. And the key is preventative care, right? We're really trying to create a healthier Bahamas. And like I said, we don't want persons not accessing primary care services because they are worried about the cost. So we want to make sure, give everybody an opportunity to be able to access services. We know that our public clinics and also the emergency room is populated, right? It's overcrowded. A lot of bottlenecks in those places. Some persons wait days to be seen. And so we're trying to simplify it as much as we can and make persons comfortable to where they're just, they are actually accessing these services and finding out what is going on with their health. And so this is why the program was created. So we're giving you access at no cost at the point of care to the NHI Bahamas plan. You're able to sit with a primary care doctor in a private facility, have access to an annual physical, unlimited general visits. You have your immunizations, your vaccinations, maternity care, pediatric care, full panel of STDs. You have all of these laboratory testing. All of these things are available to you at no cost at the point of service. And so we encourage persons to utilize the NHI Bahamas plan. It is being offered to you because you deserve it. And the quick tips whenever visiting your primary care provider, we always say find out if your doctor accepts walk-ins or appointments. This is extremely important. I always tell beneficiaries when selecting a primary care provider, you can do your own research as well. Call the facility, find out information, right? Ask a friend. But it's important that you always make sure that you are comfortable with the facility that you are selecting. However, you do have the opportunity to change at any time. Share any symptoms you may have via the telephone, right? Always make a list of your concerns. Anything that you are experiencing before your appointment, you should always write it down so that you can share that information with your primary care provider. Be open about your medical history, inclusive of any prescription or non-prescription medications that you are having, or if make sure you're mentioning any allergies that you may have as well. This always determines the cost of treatment and the medication that your primary care provider will give to you. Ask about any medication that is being prescribed. Doc, why is this medication being prescribed? What are the possible side effects and how should it be taken? This is always important for us to find out. We always have persons calling us at our office and asking us about medications where, we're not doctors and we're not pharmacists, right? And so we don't have all that information. And so I always say, have these conversations with your provider. It's so important that you're building these relationships with your physician. Your primary care provider should follow you for the rest of your life. Most people have been with their primary care providers for years and years and years, and they've built strong relationships with their primary care provider. So you should be building relationships so that you can have comfortable conversations with your primary care provider. And these are some additional contact information. You can screenshot these if you would like. We also have our new WhatsApp line as well. And the number is here on the screen. It's 813-2801. It's a WhatsApp line, message line only. So you can WhatsApp a message to us and we will respond within the appropriate time frame of between 9 and 5, or sometimes a little later as well. But you can, if you are interested in enrollment, reassignment, you have a question, anything you would like, you can send us a WhatsApp message and you will receive a response. Also, like I said, you can email us at info@nhibahamas.gov.bs, call us on 396-8500. On the screen as well, you have the names and numbers of all of our benefits specialists. You can reach out to any of them as well with any questions or concerns that you may have. Also, you can please feel free to visit our website at www.nhibahamas.gov.bs. We have a wealth of information on our website as well. So that brings me to the end of my presentation. If you have any questions for me, I can take them now, or we can wait till the end. I would like to have our wellness specialist, Ms. Chandra Sawyer, who will come on and share some wellness tip with you.
Thank you so much, Ms. Pinder. That was really informative. Really quick, I'm just gonna glance at the chat and see if we have any questions or comments. I don't think so. Okay, so I think, yeah, if Ms. Sawyer is ready,
Yes. Can you allow her to share her screen as well?
Okay.
I'll stop.
Yes, good evening. I am ready.
Okay.
Okay, let me know if you have any issues sharing.
Okay, 1 second.
And if anyone can think of a question at this time, please feel free to reach out to us on our WhatsApp line on the 813-2801, or feel free to give us a call on the 396-8500. We'd be happy to answer any questions or concerns that you may have that you can't think of this evening. Three nine six 8500.
All right, good evening. Are you able to see my screen?
Yes, we can see.
Perfect. All right, good evening, everyone. It's a pleasure to be here this evening to share some wellness information, some wellness tips, and some wellness tools that could help to encourage us on our health and wellness journeys. Like Ms. Pinder would have mentioned, my name is Chandra Sawyer, and I'm the healthcare wellness specialist at the National Health Insurance Authority. And so I want to thank Equality Bahamas for this invitation this evening. At the National Health Insurance Authority, we are passionate about creating healthier communities and encouraging our beneficiaries to get well and to also stay well. And so we have 3 tenets by which we encourage and educate our the Bahamian public on how they can adopt a healthy lifestyle. And the first one is to incorporate exercise and physical activity into their daily routine, to understand that your food should be your medicine, and to focus on your mental, emotional, and spiritual health. Ultimately, our goal is to ensure that Bahamians understand the importance of a well-balanced life. And this could ultimately enhance their overall health and also impact the well-being of our nation. And so this evening, we want to educate and inform the Bahamian public on the 6 best doctors. And these best doctors, as Wayne Fields once said in his nursery rhyme, the best 6 doctors anywhere, and no one can deny it, are sunshine, water, rest, and air, exercise, and diet. These 6 will gladly you attend, if only you are willing. Your mind they will ease, your will they will mend, and they will charge you not a shilling. So these 6 best doctors are ultimately our free doctors. And we live in a country where most of these doctors are at our fingertips, are at our disposal. And so, yes, we definitely want you to take advantage of the National Health Insurance Bahamas program, where you're going to visit your doctors, getting those annual wellness visits whenever you're feeling sick. You definitely want to get those checkups, but we also want you to focus on making sure that outside of your physician visits, that you're also taking the best care of your health as best as you possibly can, using the resources that we have. And so the first doctor we have is called the Doctor of Sunshine. And like I said, we live in the Bahamas and we are in the winter season. And if you travel to some parts of the world, they do not have this blessing and this privilege of having access to sunshine 24/7. Well, once the day is up, all right? In some parts of the world, the daytime is relatively dark, especially during the winter months. And so you find that persons in those parts of the world experience what's called SAD, and that's a seasonal affective disorder, which means that their mood is pretty much affected by the lack of sunshine that they're experiencing in their environment. And so when you expose yourself to sunshine, a lot of times persons shy away from that because, oh, it's so hot. It's going to burn the skin. But yes, if you're not protecting the skin by wearing sunscreen, it could be detrimental to your health, and especially prolonged exposure to the sun would ultimately affect your skin. But sunshine is known to have a positive effect on your mood and your sleep, whenever you're exposed to sunshine, particularly for 3 to 15 minutes, your body releases what's called a feel-good hormone that's called serotonin. And these serotonins help you to not only relax, but also to help you to stay calm. And ultimately, it improves and impacts your mood in a positive way. And so if you find that you're angry, right, you're at work, step outside into the sunshine for just about 3 to 5 minutes and take some deep breaths. And particularly if you expose yourself to the sun, especially first thing in the morning, it would set yourself and it would set your day up for a positive experience. Also, vitamin D is also released in the body when you expose yourself to sun. And optimal levels of vitamin D, from a clinical perspective, it can reduce your predisposition to cancer. It can also reduce your predisposition to things like cardiovascular disease, which also is attached to or connected to high blood pressure. It can also reduce your obesity level and type 2 diabetes. And all of these are actually chronic non-communicable diseases which we acquire due to our lifestyle behavioral choices. And so if you plan to get in some morning sun and midday sun, a little as 3 to 15 minutes a day can definitely benefit your body and your mood. Doctor number 2 is the doctor of water. 70% of our body is made up of water. And most times we find that we can go days without drinking water. If you find that you are at the point where you are thirsty, your body is already at a state of dehydration. And so it is so important to drink water. It improves your energy. It helps your body to flush out toxins. If you're trying to lose weight, it definitely helps to enhance that weight loss process. If you find that you're having headaches a lot, it helps to reduce the level of headaches that your body is experiencing. And it also helps with digestion. Our population, I'm sure if you sit down and you ask someone, how often do you go to the bathroom in terms of your bowel movements? Naturally, every time you eat, you should have a bowel movement. But if you're not having that, it can be impacted by your water intake or the lack of your water intake, and also your diet. And so if you have a high fat, high carbohydrate diet, but you're not getting in a lot of fiber from fruit and vegetables, you're going to find that your regularity is going to be out of whack. And so if you drink at least 2 liters of water a day, that's about 67 ounces. Or if you drink half of your body weight in ounces. So if you weigh 100 pounds, half of your body weight in ounces would be 50 ounces a day. If you weigh 200 pounds, half of your body weight in ounces would be about 100 ounces of water a day. And so that 67 ounces, which is about 2 liters, would be a good start for you to increase and even maybe take it down depending on your body weight. And so this is a very good habit that you could kickstart throughout the day. I also want to encourage you, if you have access to a water bottle, travel with a water bottle. For those of us that go to work during the daytime, most workplaces provide water as a free beverage of choice, right? In addition to maybe sometimes having tea and coffee and hot chocolate. So definitely take advantage of the benefit of having and the access that you may get to free water for those of us that are going into the workplace. The third doctor is the doctor of rest. All right. When you're fatigued and you're irritated and your brain fog set in, you can hardly recall what it is to feel truly rested. And when you're sleep deprived, those 3 symptoms tend to kick in and they're heightened. Sleep deprivation also leads to increased stress levels, so that ultimately will affect your mood. It increases your high blood pressure, which is also would affect your heart rate. It impairs your body ability to break down or control your blood sugar levels. And so that's where your susceptibility to acquiring type 2 diabetes come in. You increased inflammation levels in the body. So you may find that you're always swollen, you're having circulation issues, your immune system is depressed. And so if you find that you're tired, right? And after you're burning your body out because you're not resting sufficiently, eventually your body is going to force itself to stop. And that's where you're going to get sick. And you find that it's easier for you if you walk into a room where someone is sneezing or coughing, minutes later you can walk out of that room and you start sneezing or coughing because one, that connection where your immune system is compromised due to your lack of rest or your sleep deprivation, increases your ability now to acquire those communicable diseases such as the cold and flu. Lack of sleep also impacts your brain function or your cognitive performance. And so if you find that you're struggling with getting rest, right? This is definitely a conversation that you should have with your primary care provider. And I want to put in a plug again with the NHI Bahamas program. This is a conversation that you can have when you go to see your primary care physician. And that's a conversation that you can have at no charge, all right? So we want to make sleep a priority and aim for at least 7 to 8 hours of sleep per night. Develop a bedtime routine, develop an environment. So if you find that, okay, you're not sleeping well, let's think and let's look at external factors. Are you sleeping with the light on? Are you sleeping with your television on? Are you sleeping with your cell phone on? And so every time a notification comes through, the phone is pinging. And so you find that you're pitching up and you're not able to get into the deep sleep that you need. So take a look at your environment. Maybe set a routine. Maybe you take a shower, you drink some tea, you lie down in a dark room and allow your body to just naturally fall asleep. And you find that that can help with your sleep hygiene and your sleep health. Doctor number 4 is air. And we often take air, oxygen, and breathing for granted. A lot of times we don't stop to breathe. Yes, we are breathing to live, but we're not breathing to survive. What I mean by that, we're not stopping and taking deep breaths in. Oxygen has very healing properties. And so if you find that when you're stressed out, and if you just stop and breathe, it can reduce your stress and it can also improve your mood. And so we want to practice deep breathing. I often tell persons, like, if they're going into a high stress meeting or you're probably coming up against a highly combative colleague or even a family member, let's bring it there. Or you may have a stressful time at school. We are we're coming to the end of, for some persons, the end of their school semester. And so you may be studying for exams and you're always on edge. If you just stop, close your eyes and take some deep breathing, take some deep breaths in and allow your stomach to inflate and exhale and allow your stomach to deflate. And if you set a timer for at least 90 seconds, I guarantee that that would help you to reduce your stress levels. Another way that you could also increase your air quality and improve your air quality and improve your deep breathing capacity is to incorporate activities such as yoga and Pilates. Add that to your weekly routine. Start off with just 5 minutes a day. Start off small and then gradually increase that. Your ultimate goal is to practice 90 minutes of deep breathing every week and not every day. So 13 to 15 minutes would be a good start. But like I said, start off small and then gradually build out. And you would find that that deep breathing would also help to calm and center your body and improve your mood. And it would help you to also manage your stress levels. Doctor number 5. This is called the doctor of exercise. Exercise for some persons can be a very intimidating word, so I don't want to use exercise. Let's say move. Let's just get up and move. Because moving, exercise is a form of movement. Movement can also be dancing. Movement can be cleaning. It can be washing your car, because you can also wash your car in an hour. And because you're constantly moving, that's another form of physical activity that would accumulate to the exercise that you would need. Gardening is also a form of movement, which can equate to exercise. So whatever it is to get your body moving, find it where you can also break up a sweat. It can get your heart rate up. Something is always better than nothing. The number one barrier as it relates to moving and exercising is time. We always say, I don't have time. I don't have 30 minutes. I don't have an hour. I don't even have 5 minutes. But guess what? We often have the time. We just overthink it. And so when you think about an hour, let's not think about that full 60 minutes allotted to movement. Let's break it down. So I'll give you an example. If you have an 8-hour job and you're at your desk for 8 hours a day, right? If you just take, let's say, 5 minutes out of every hour of your work shift, out of your 8-hour work shift, If you multiply 8 hours by 5 minutes, you would accumulate 40 minutes of movement right on the job, and you need to find that extra time. Let's take it up. Let's take it up to maybe 10 minutes. So if we move for 10 minutes at every hour while we are at work for an 8-hour shift, if you multiply that by 8, that's 80 minutes. And we would have surpassed that 60 minutes that our body would need in order for us to, one, maintain our heart health and also ultimately help us with weight loss. So set a timer when you're at work. Set a timer if you're a student, if you're studying, to just get up and move, even if it's 5 minutes. Start off with something that's very small and attainable, and then work your way up. Exercise helps you to develop stronger muscles and bones. It protects against depression. It increases your metabolism, and it helps you to manage a healthy weight. So plan at least 150 minutes of movement into your week. I know we're in the holiday season where we're bogged down with a lot of celebration moods and partying. When you go to that party, don't just sit down at the table and, drink and eat. Get up and move and walk around the dance floor and socialize. And if you're partying, if you're going to a function for at least 3 hours, try to move at least for 20 minutes out of 3 hours, right? And if you can move, and you'll find that after a while, you would probably move around for at least an hour, and you would have accumulated the physical activity requirement that you would need for that day just by attending a party. So the dance floor is a perfect opportunity for you to get that time in, because what? Because why? If you're a person that loves music and you love dance, and if there's a nice band and it's an awesome DJ, you weren't even thinking about that. And then if you have an awesome dance partner, right? Or you dancing with a group of friends and you're all having fun, and then I'm gonna add in this little point. If you have a little bit of libations, right? That would definitely keep you on the floor. And then you'd break up a sweat, you get that heart rate up, and you wouldn't even have to find that extra time that you need to make your physical activity requirement for the day. So let's think about how we can move without finding that extra time with the time that we have in our daily lifestyles. I always like to encourage persons and educate them on the FIT principle. So the FIT principle is an acronym that stands for frequency. How often are you going to move, right? The intensity. How hard are we moving? We live in an age where we have access nowadays to fitness trackers, whether it's through a watch or if it's attached to your phone. Most times we're moving around with our phone in our hand, so we could use that to measure our intensity level. When you're working out, you want to be able to break a sweat, but still be able to hold a conversation. If you're not able to talk when you're moving, that means the intensity level may be a little bit too high. So you want to bring it down just a little bit, right? Not too much where you're not sweating, okay? Then the first T is type. What type of movements are we doing? Are we are we focusing on cardiorespiratory movements? Are we focusing on muscle strength and endurance movement? Are we stretching? Stretching is a form of movement, okay? And then the last T, focus on the time. How long are we moving for? Are we doing it for 5 minutes? Are we trying to hit our target of a minute, of an hour? You choose wisely as it relates to your time, your schedule, and what your body can produce and perform. Doctor number 6, and this is the doctor of diet. All right. We live in a very carb-heavy nation where everything on our plate is always carbohydrates. We find a way to turn vegetables and fruit into carbohydrates, because we add things like mayonnaise and oils and things like that that takes away from the natural and chemical composition of these foods that would provide the benefits that our body needs. So I'll give you an example. Coleslaw, right? You just add mayonnaise. Some people add butter, and some people add sugar to coleslaw. Wow, that's a lot of sugar, right? So you could have coleslaw in a healthy format. You could add things like olive oil. You could add balsamic vinegar to your coleslaw. It's going to reduce the fat content, but it's also going to make sure that the foods like cabbage and carrots, for those of you that may add like maybe raisins or celery to your coleslaw, it would help to make sure that the chemical composition of those natural vegetables and fruits are not altered, and which means that your body would now benefit from the maximum macronutrients that those fruit and vegetables can produce. You want to focus on eating whole foods wherever possible. Think 80-20. So 80-20, Monday to Friday, your diet is on point, right? You've been drinking no alcohol. You may have one carb here with your meal instead of having 3 or 4 carbs. You may have one protein, all right? You ain't adding too much sugar to your coffee or your sugar. You ain't drinking out at Starbucks too much every day. You may indulge once that week. And so if Monday to Friday, you're having a perfectly or as close to possible, you're eating 80%, your diet is as 80% perfect as possible. Then that 20% you could now splurge on the weekend. All right. Now, don't want you to splurge the entire weekend, but definitely you could allow yourself to maybe indulge in something that indulge in that unhealthy treat that you would probably eat every day of the week, but you cut back on that Monday to Friday, so you could get away with having it maybe on a Saturday or a Sunday. So, for example, you don't have desserts on Monday to Friday, right? So after your Sunday meal, you could treat yourself to a cup of ice cream, okay? You cut back on soda, so you don't have soda Monday to Friday. So maybe on Sunday, you can have that can of soda that you've been craving all week. And so eat whole foods wherever possible. These whole foods include vegetables, fruit, lean protein, healthy fats like fish, nuts, and seed. When you have a healthy diet, it will improve your mood. Mood is a big word. That word been coming up a lot with these doctors. All right. It increases your energy, aiding in digestion. That's another benefit that keeps coming up in these 6 doctors. And then it maximizes your micronutrient intake, which means that it gives your body the ability to absorb the vitamins and minerals that are found in those foods. So when you think the colors of the rainbow, that's how you want to eat. Eat the colors of the rainbow. God has blessed us with so many fruit and vegetables that are local and native, and even those that are exported. You can still find some benefit from some nutritional value to those fruit and vegetables. Have a meatless meal once a day. I know that's a big challenge, but guess what? It's doable. Let me tell you why. I'll give you an example of a meatless meal. If you have scrambled egg and you load that up with some vegetables, I guarantee your body would feel the benefits of that scrambled egg, because why? It's a high protein meal. And then you're adding the vegetables that your body needs, the micronutrients that it needs. And so it'll keep you fuller for a longer time. And then you're exposing your body to the antioxidants that it needs to help you to fight off diseases and cancers. And so also try to consume a vegetable with every meal. That's very possible also too. So think about, sit down, if you're eating out. So say and I'll use this example, Wendy's, right? You go out to Wendy's, you may want to buy a burger, but let's substitute the fries with a side salad from Wendy's, okay? That's a healthier version. And I guarantee if you make those small changes to your diet throughout the year, throughout the week, throughout the month, throughout the day, your body would thank you for it, and you would start to feel the benefits of healthy eating. And so this is what a healthy plate would look like if you're following the doctor of diet. Half of your plate should consist of vegetables or fruit. A quarter is reserved to one starch. And so that's where the coleslaw, the potato salad, the peas and rice could come. But not all 3 of those things all in one time. And then ultimately we want to focus on one protein, a quarter protein that could fit in the palm of your hand. So if you look at your hand, everyone has a different palm size. So you're going to eat for your size, okay? A male's palm would definitely be bigger than mine as a female. And so we would be able to get away with having a little bit more protein or a little bit more meat. And then you could also think of a protein sauce could also be a vegetable sauce. So that's like things like beans and legumes, all right? You want to add that to your diet a little bit more. And that would help with aiding in your digestion. And so at the National Health Insurance Authority, some of our programs that we focus on that are open not only to our beneficiaries and the public at large, once a month, we host a Power Hour, which is a complimentary workout session. And this is often led by a certified fitness instructor. For the year, we have been hosting these sessions at the Holy Cross Anglican Church in their parish hall. And so it is our intention to continue that relationship with them. Once a month, you have an opportunity to learn with us for free through our beneficiary educational sessions. So sessions such like this would count as our beneficiary educational session. And we focus on a health and wellness topic, or we would focus on some aspect of the NHI Bahamas program. And these sessions are often held in a virtual environment because we are trying to reach the entire Bahamas. We realized that the Bahamas is outside of Nassau and the Providence, and so we want to open up the sessions to those beneficiaries and Bahamians in Inagua, in Bimini, in Mayaguana, and Grand Bahama. Even those Bahamians that may be living overseas, so that when they come home, they know that they have access to health and wellness resources. And then once a month, we host a farmers market, which is at the fourth Thursday of every month. And this is an opportunity for you to shop local and find organic, healthy produce and at a very low and affordable rate so that you can incorporate that into your lifestyle. And so these are some flyers that I want to share. This is a flyer of our beneficiary educational session. In November was World Diabetes Day and National Diabetes Awareness Month. So we focused on diabetes, health, and education. Our power hour, our last power hour for the year was on Thanksgiving Day. And so we hosted a Zumba fitness workout with Vanessa Perry-Gord. And then we also partnered with the Ministry of Health and Wellness, where we offered free health screening at that power hour. And then our farmers market. In our farmers market, not only can you come and purchase produce, but we also partner with local vendors who may sell things like pastries, candles, hair and skin products. We also have a mindfulness space so you can come and purchase a chair massage while you shop. And then we always have a lunch vendor who's preparing healthy lunches on site. And so you can order your lunch to go, or you could even sit down and enjoy your lunch in the comfort of the farmers market at our courtyard. And so we hope that Equality Bahamas would be able to continue to partner with us next year and come and join us at some of our wellness opportunities. And for those of you, if you have any questions, feel free to place your questions in the chat for myself and Ms. Pinder. And this is my contact information. I'll also type it in the chat for those who may need it. Again, thank you very much for this opportunity.
Thank you, Ms. Sawyer. That was really, really informative, and I think really touched on a lot of, a lot of things that Bahamians need to grapple with, like making sure our plate ain't consumed with the carbohydrates. We are work in progress, but it's nice that, the National Health Insurance Authority is working to educate folks, because it's a work in progress.
Yes, definitely.
Mm-hmm. So I see we have some questions in the chat. I'm just going to read them off, and I believe they're for Ms. Pinder. So this first one says, can you talk about access to eyesight and dental services? I believe this is in reference to the health plan.
So good night again. So currently under the program, we do not cover vision or dental. The program is just primary care services. You are entitled to your visits with your primary care doctor, your annual physical. So dental, vision, emergency care, diagnostic imaging, medication, these are all things that are not covered under the program at this time. The program is being rolled out in a phased approach, and we are looking to be able to add additional benefits as the program continues to grow. It is a government-funded program, and so therefore it has to go in stages. And so we thought it was important for us to start off with primary care services and also labs, because we all know how expensive labs can be. And we do have over 73 lab tests that is covered under the program. However, dental, vision, diagnostic imaging, all of these are things that aren't covered, but we are looking to add these as we continue to grow the program.
Okay, and I think in a similar vein, this question, I'm gonna ask this last one, and then we're gonna address the one before it. But this question says, Are there any mental health services covered by NHI? And they would also like to know what obstacles there are to medications being covered and how we can speed that up as a public.
So when the program was launched, it was launched with the intentions of preventative care, right? And that would cover the basic primary care services. And so, like I said, it is a government program, and the prescription drug plan was a program that was already existing, right? Before NHI was rolled out. And so under NHI and the prescription drug plan is two separate entities at this time. And so medication, there are certain requirements for the prescription drug plan. If you wish to, you can visit NIB's website to see what those requirements are. But that is a separate entity at this time than NHI. They are two separate entities, and so we can't speak too much on the prescription drug plan. However, we do encourage our beneficiaries, one, to go on their website, read upon the prescription drug plan, see what those requirements are, and also have that conversation with your primary care provider. They can also assist you in registering for the program, or you can visit any of the social services offices here in country, and they will also walk you through the program and advise you as to how to become eligible for the prescription drug plan.
Yeah, I could see that being easily confused too, because I for a very long time thought that this health plan, this new initiative, I thought that this was one and the same with the drug. Yeah, so I could see that being confusing.
Hopefully for the future, right? We can combine the two programs together.
Yeah, definitely. Okay, so this next question says, can we expect to see incentives provided for individuals and families that hit specific medical, health, and wellness markers and/or participate in community exercise and healthy eating programs?
So I'll have Ms. Sawyer speak to the latter, but like I said, the program, there's so many benefits that we have that we would love to be able to add on to this program. But we have to take our time and we have to roll them out as we feel the importance. So like I said, our next phase is going to be diagnostic imaging. And that is something we're pushing hard for, because once you go and have that annual physical, your next step is going to be to go and have blood work done. If your blood work come back irregular, then doctors more than likely send you to go to do some form of diagnostic imaging. And so that's why we're looking at diagnostic imaging as our next phase of the program. So we do have several other benefits that we would love to be able to add to the program, but we have to roll them out in phases as we continue to grow the NHI Bahamas plan. I'll have Ms. Sawyer speak to the community exercise programs.
All right, good evening again. So at this current moment, we do offer our community exercise program on a monthly basis. Right now, we're offering it once a month. Not sure what the frequency will be like in the future, but right now at this moment, we have the opportunity where we are offering it once a month, and we're definitely looking for opportunities to partner with other organizations to make this possible. If you also follow us on social media, we also provide educational information through nutrition education. I know we hosted a NHI Goes Green Challenge, where we posted some healthy recipes as it related to eating green and implementing more greens into our Bahamian diet. And so it is passive programs like that that we want to continue to implement via social media. And we did offer rewards for those individuals who would have posted on a regular basis. We would have tracked their posting, their participation in the challenge through the use of a hashtag. And so I would also want to encourage you, for those that don't follow us on social media, to follow us on social media, because you also have access to not only education, but then we also release opportunities for us to implement the education that we would have shared with you. We hope that you participate, and then we definitely would continue to reward those persons that are active participating in those challenges.
Okay, that's awesome. I have a question, and I think you mentioned this, Ms. Pinder, in talking about, there's really just two requirements. One, that you are a legal citizen and resident in the Bahamas, and I think the other was that what was the other requirement for enrollment? Oh, that's not,
So
yeah.
yes, yeah. So you just have to be a Bahamian citizen and a legal resident, right? That means on any type of a valid permit in country, right? That allows you to be here, that allows you to be in country. And then have a valid smart card. That's the NIB, the new NIB cards, right? Now, a lot of those cards during COVID, they allowed those cards to expire. However, NIB is now running a campaign to encourage persons to come and have their cards updated. So I would encourage everyone to go to NIB and have if your card is still, if your card is expired, go and have your card updated. If you've lost your card, note that you have to go and report it to the nearest police station in your area of residence, and you have to have a letter from the police to take to NIB for a replacement card. But please know they are running a campaign for everyone to come in and renew, to update their NIB card. So you must have a valid NIB card.
Okay, got you. And is it rolling? Like you can enroll at any time?
Yes, enrollment is ongoing. It's ongoing. Like I say, there are ways that you can enroll. You can either send us a WhatsApp and say that I'm interested in enrollment. We will then send you the required information along with our providers listing, where you can choose one of the available doctors, or you can just give us a call on the 396-8500 number, and one of our benefits specialists will assist you with enrollment over the telephone, or just visit us at our office on East Street and Purpose Way, 9 a.m. till 5 p.m. Monday to Friday, and we can enroll you. Enrollment is on the spot. It only takes about maybe 7 to 10 minutes to facilitate the enrollment, as long as you've already made your selection of whom your provider is, okay?
Okay, yeah, that's good information. I want to just remind folks that are on the Zoom call, if you have any questions that you want to ask, feel free to drop them in the chat. If you want to remain anonymous for the recording, but if you would like to just ask out loud, just feel free to raise your hand. I have
If I may as well. Oh, I see. I think there's a hand raised. Go ahead with the question.
Hello, my question is about selecting the primary care physician. I know that a lot of people were complaining about not being able to get the doctor that they've been with forever and ever, because they were full or maybe not a part of the plan. Are more doctors signing up to be a part of it? And are there spaces opening up? And also, how easy is it to switch doctors if you need to?
Excellent question. And so the program works by choice for both our beneficiaries and physicians in country. So physicians can choose whether they would like to be a part of the NHI Bahamas plan or not. That's the first thing. So all of our physicians, the max amount of commitment hours that our providers are allowed is 42 hours, right? And so 42 hours would allot them some 2,000 patients. They can't go over 2,000 patients. And that's simply because, as I said, we want to make sure that our beneficiaries are satisfied, right, with the services that they are receiving. So we don't want to over allocate our providers. And so the max is 2,000. So if you see a doctor that is showing full, that's because they've already met their max allocated number of persons that can be under their panels. Now, yes, those popular doctors, they're gonna get filled first, right? All of our doctors must meet the exact same requirements in order to get onto the NHI Bahamas plan. Everybody has to meet the exact same requirements, documentations, facility inspections. They all meet the exact same requirements. The doctors also have different specialties as well. So beneficiaries, we always say, take your time and take a look at the providers listing to make the right choice. Your provider or your current primary care provider may not be a part of the NHI Bahamas plan. Have that conversation with them and encourage them to sign up for the NHI Bahamas plan, right? Currently, we do have registration for our onboarding for our providers on hold, but we will be resuming that next year. But we do have several physicians right now, facilities in the pipeline that we're also going to be adding on next year in 2025. But like I said, the program, there is max amount of beneficiaries that each provider can have on their panel. So if they're full, that's because they've met the max.
Yeah, that makes sense. I kind of have a follow-up question about that because I know, and I'm asking as a person that is a daily wheelchair user, and I know many facilities in Nassau tend to be inaccessible. So I'm curious for patients that have particular access needs, is there a way that they're maybe prioritized in that process to make sure like they're being matched with a provider that has accessible facilities and they're not just, being forced with,
So that's an excellent question as well. All of our facilities are required to have wheelchair access. You cannot get on the program unless there is one. It is a requirement for them to get on. So if you send in an application and when we conduct our facility inspections, you must meet all of the requirements on the inspection list in order to get approved for the program. Wheelchair access is one of the top priorities on that list.
That's good to hear. I was also thinking when you were talking about, the distinction between the coverage for maternity care and, it not extending to delivery. And so I'm wondering if you can maybe just shed some light on just a little bit of what maternity care services might cover for any folks that might be watching this and be like, at what point does that stop,
Yeah. So for the expecting mother, she is going to be entitled to 7 to 9 visits, right? That's your monthly visit. In those high risk pregnancies, then it's a little bit more, right? But your OBG provider will advise us to, if there needs to be more visits, they will advise the patient as well as NHI that beneficiary is high risk and needs a little more care. So normally you're looking at, I would say when at about 34 weeks, between 34 to 36 weeks, it depends. Every provider is a little bit different and determines, how soon or how much later they want to keep that beneficiary with them. Some beneficiaries want to take it all the way to the 40 weeks or 39 weeks and just have that one last visit at the public clinic if they decide to go with that. But it's a conversation between the provider and the beneficiary. Most providers, like I say, will release the beneficiary between 34 to 36. 36 is normally the max that they would take it up to. But like I say, it could go a little bit further. But within that time, that 36 weeks, that's to give the beneficiary opportunity to have at least one visit at the public clinic. And then they would also need to be able to go and take that referral to PMH maternity to make sure they set up for their maternity care at PMH as well, or the RAN in Grand Bahama. So that's the transition for right now. But like I say, we are looking to try and close that loop because we recognize that it's an inconvenience, right, for our expecting mother. She's already so comfortable with her current primary care provider, her OBG, and now she has to transition. And so we're trying to see how best we can close the loop. So we are in conversations with the minister and the executives at PMH, and we're trying to see how best we can close the loop. to make it more convenient for our expecting mothers.
And so with this expansion that's happening for x-rays and various services, currently, if an expecting mother needed scans and things like that, would that be covered, or would that only be covered with the expansion of services?
Only at once the expansion is approved and it's onboarded and the benefit is added, then currently no diagnostic imaging is covered under the plan. So if she does need ultrasound, then that is an out-of-pocket cost to the beneficiaries.
Okay. Thank you so much for
You're
clarifying.
welcome.
Well, if we don't have any burning questions from, oh, we do have a question.
Okay.
Are NHI patients registered as public or private patients at PMH?
At PMH, it would be public. With their current primary care providers, it's private.
Okay. Yeah. Well, I wanna go ahead, Aaron.
Hey, good evening. Hi, Ms. Pinder, and hi, Ms. Sawyer. It's a great presentation, awesome information. So the question about NHI patients. So I am NHI. I had a referral to the oncology ward, right, from my NHI doctor. Now, when I went to the oncology ward, they were very clear that most of the procedures there and the things there, that they're cost attached, right? That those things aren't free. There's no problem. But I had to go into theater. The procedure I needed couldn't be done in the clinic. And so when I prepared for theater, PMH quoted me a set of prices for tests, right? When I went to pay for the test, with the form that they gave me with the cost of the test on it, the cashier quoted a price that was double what was on the form without actually acknowledging, right, that, hey, this price is not what's on your form. So I said, I'm looking at the form and that's double what I was told I would have to pay. Why is that? And so they told me that I'm a private patient. So I said, how am I a private patient? Right? Like, I'm an NHI patient. The whole purpose of NHI is for people who can't afford private insurance and can't afford they're coming to the public ward. Right. And I was on the public ward. And so some doctors and people said, PMH staff, or I guess PHA staff, said that NHI patients are supposed to be registered as public and pay whatever fees that you would pay, for the public ward. And then some other people said, no, things changed and you are considered a private patient. And so you're going to pay a higher category of fees.
That is correct. So to my knowledge, the NHI patients are private patients, right? Private physicians cannot, they can only refer you to PMH. But with a referral to PMH, that's still, you would still have to go to PMH, be registered as a public patient.
Which is what I attempted.
They do not accept. So even with referrals, normally you wouldn't, even if a private doctor gives you a referral to go to PMH, they normally will scratch that and ask you to see one of their physicians, one of the public physicians, and have the public physicians rewrite that. Private doctors cannot write up.
But I went from the ward. No. My NHI referred me to the ward, right? It was the ward that referred me to PMH, because I had to go into theater for the procedure. And they couldn't.
So you were on the private ward?
No, I was on a public ward.
So you registered you registered as a public patient.
That's what I thought.
Right. Oh.
That's
Yeah,
what, you know what I'm
because you
saying?
would have had to have been registered as a public patient in order to receive the public access, right, to
Right.
PMH. Yeah, you can't, a private doctor, unless you're on that private ward, and you will be paying those private fees if you're on the private ward. And that's why when I was talking about the maternity care, and this is why we separate the two, the doctor will have that conversation because you have to register, decide where you're gonna go, private or public. And then there's a registration that has to happen on either end. The private doctors cannot write up prescriptions or referrals or anything like that. They will send you and tell you, okay, now you need to go to the oncology clinic at PMH, but then you will have to attend oncology clinic at PMH, see the oncologist on call at that clinic, and then they will write up whatever additional treatment that you need in order to access it through the public clinic. But the private doctor can't do that. You know, in the future of NHI, we're hoping to be able to close these gaps, yes, and combine the two programs together. But at this time, because like I said, the program right now is just set for primary care services, give access to lab services, and hopefully be able to add diagnostic. So that's where we're at right now, right? But we're hoping to be able to bring all of these entities together and create one big healthcare program. But for right now, this is what NHI covers, and this is where we're at. So private, yes, you have
I
access
mean,
to
I
private physicians
I just
and
have
the
to
NHI.
I just have to reiterate. I was at the PMH ward, oncology ward, and I was on the public ward. As far as I was concerned, and I was told initially I was registered on the public ward, right? They quoted me prices, and so when I went to pay, right, they told me, "Oh no, you haven't been registered as public. You've
Mhm.
been registered as private." But with my earlier meetings, I was told that I was being registered as public, and
As
that's what
public.
confused
Yeah,
me.
so it sounds like
Yeah,
an error on their part during registration,
I got you.
and
Yeah,
yeah, it seems like there was some error during the registration period to where they probably still had you in the system as private and they never registered you as public. That's how it sounds to me. I hope that you were able to have that cleared and receive the correct billing from the public clinic.
yeah.
But
No, no.
definitely I would clear that up with registration at the
Yeah,
business office.
I took care of it.
Okay.
Yeah.
But yeah, two separate entities at this time, and we're really hoping to be able to close the gap, because I
Mhm.
understand exactly what you're saying.
Yeah.
Yeah,
Thank
you
you.
got to move those bottlenecks, right,
Yeah.
out of the way or the bureaucracy and try to bring the programs together.
Awesome. Thank you so much.
Thank you for the question.
When go ahead, Alicia.
I am always curious about how different organizations, entities, departments are talking to each other. So following on what Ms. Sawyer presented about the 6 doctors and talking about the need to change the way we eat, when I think about the way that Bahamians eat, I also think about the way that we grocery shop and budget. And of course, the issue of VAT on breadbasket items, I think about that, and that produce isn't included in that. Are there conversations that are happening between the NHIA and the Ministry of Health and any bodies that have anything to do with taxation to figure out ways to implement policies that make it easier for people to make the healthier choices?
That's I love that question, and that's a good question. So I don't sit at those tables, but I do know that they are having those conversations. That's the most I can say on that. But that is that is something that is being discussed. I can't really speak further on it, but I know that those conversations are being had because that is also very important to us at the authority as well.
Okay, and we had somebody email to ask how they could get monthly information on the programs that you offer, like the exercise program and the farmers market. Is there a mailing list or how do they get those?
So once registered, if you provide us with a valid email address, you should be receiving emails from NHI. So I would suggest giving us a call or shoot us an email or WhatsApp us to confirm your email that we may have on file. Maybe that needs to be updated if you're not receiving emails, because we do send those out monthly for those activities that we do have on a monthly basis.
Thank you.
Additionally to Ms. Pinder, just also wanted to add to your response. If you follow us on social media, in addition to the email blast, our social media pages are updated every day. We are dropping content. Our marketing team drops content of some sort. And so you can follow us on Facebook as well as Instagram at NHI Bahamas. Those two pages are active, and they would also contain information on our farmers market. We're also on Twitter and LinkedIn, and so you can also find information about our wellness opportunities on those pages too.
Awesome.
Thank you. Yes. So, Ms. Trika, I just kind of want to update everybody to let them know that we're also encouraging our beneficiaries to go and utilize the services, right? We have over 160,000 beneficiaries that have been registered. And so we want to encourage everyone to utilize the services. Our providers are being compensated for every beneficiary that is under their panel. And so our initiative right now is to have everyone utilize the services. For persons that have been registered under the program that have never used the services at all, we are looking to contact you. If we're unable to reach you, then you will be made inactive under the NHI Bahamas plan. We've already made several persons, some 12,000 persons inactive. And so if you're on this call, you are a beneficiary of NHI, you have not accessed the services as yet, I encourage you to go ahead and make that first appointment to have your annual physical done. All beneficiaries are required to have at least the annual physical in order to remain active under the program. So tell a friend, text a friend, let everyone know if you are registered to please just go and have your annual physical done, because we will be reaching out to assist you in making an appointment if you need help with that, or inquiring as to why you have not used the services. If we're unable to verify your information, that means maybe your telephone number is no longer valid, your email address is no longer valid, your area of residence is no longer valid, and you have not accessed the services, you will be made inactive until we are able to connect with you. And so I encourage everyone to please go ahead, utilize the services. The program was created for all of you. It's something that you deserve. Right now, yes, currently it is just primary care services, but that's how it starts, right? In healthcare, you get access to primary care services. You have over 72 lab testings that is available to you. And so we ask that you utilize the service, take advantage of the services. And like I said, as simple as just having that annual physical in order to remain active under the NHI Bahamas plan. So if you haven't done so, please go ahead and make sure that you schedule your first appointment for the annual physical. If you're having trouble getting an appointment, feel free to reach out to any one of our benefits specialists who will assist you in making that appointment with your primary care provider.
I know that Doctors Hospital offers the LAMP program, and one of the options is in combination with NHI. So if I am using that, is that registering to NHI as a use, or is it only showing up as a LAMP use if I get my annual physical? Do you know?
So as an NHI beneficiary that is registered with Doctors Hospital has a special incentive to their beneficiaries. They add you to the LAMP program. So you get added benefits as well as what is already offered to you under NHI. So those are just added benefits. So once you access the services and go and have that annual physical, yes, that is registered as you utilizing the services under NHI.
Okay. Yeah, thank you for that question, Alicia. I wasn't aware of that.
The doctor's hospital is full. They're fully allocated.
I bet.
Yes.
Well, yeah, I mean, if anyone has any burning questions, this is your moment. Ask away. I just want to go ahead and thank you so much, Ms. Pinder and Ms. Sawyer, for being here on this, during this very busy time in general, and taking the time out of y'all's evenings to educate the people. We appreciate it.
We appreciate the invitation, and I love all of the questions and the engagement. This is exactly why we do this. It's important to us that we are educating persons on the NHI Bahamas plan. And anyone have any additional questions that you may think of later on, like I say, feel free to reach out. We get excited to answer these questions. We always get excited also to connect with our beneficiaries and the public. And so feel free to reach out. And we want to say thank you so much for the invitation. And like Ms. Sawyer said earlier, we look forward to maybe working with you again in the new year. Or have you come down and visit us at our location on East Street and Purpose Way and participate maybe in one of our initiatives that we hold monthly. But we want to just say, NHI made the decision to invest in primary care services. It's just designed to ensure that all Bahamians have access to quality healthcare, inclusive of primary care services and your labs, right? And this allows us to improve quality to ensure that our patients in the healthcare system can access these services at no cost at the point of service, right? No financial hardship. We talk about insurance and how expensive it is. And so we really just trying to see how best we can assist. At NHI, we're extremely passionate about creating a healthier Bahamas, and it's going to start with each and every one of us, right? And having those annual physicals is extremely important, even when our body's telling us that we fine. We know that that's not always the case. And it's important that we're sitting with our providers, we're having those annual physical, having the blood work done, and then we can feel comfortable when it comes back and everything reads fine, you're good here, this level is fine, that's good, you're perfect, you're in good health, right? But if it doesn't come back, now you get to spend more time with your doctor, right? And they start to manage these things for you. And that is what NHI Bahamas is all about, right? It's about making sure that we're managing any of these sickness or diseases that we may have. We're trying to lower these numbers, right? We don't even want to be on the list at all when they do these statistics. The Bahamas, we don't want to be on those lists, right? We want to try to eliminate as much of these diseases as possible in country. We have young people now being diagnosed with chronic kidney disease, right? Obesity is a serious thing here in the Bahamas, right? You have cholesterol levels, people with hypertension. So all of these things, we're not going to discover these unless we're having these annual physicals done. And once we catch it, we can start to manage it. And that is why NHI Bahamas was created for each and every one of us. And so we give you access to these services. And so we thank you all so much. And we say spread the word. And we look forward to working with you again in the future. So thank you so much. And Ms. Soy, I don't know if you have anything else, but I am just grateful that we had this opportunity. So thank you all so much.
Yeah, I definitely echo your sentiments, and I definitely want to encourage everyone to have a happy holiday, to continue to remain safe and healthy in during this holiday season. The holiday season is like this is like probably like 2 weeks. For some persons, it's probably a month. And at that time, we forget about everything that we would have done within the year. If we want a fitness journey, if we were eating right, we let that go for this month. Or for some persons, it may be 6 weeks, because although January first start the year, some persons don't start their New Year's resolution until after that majority holiday, right? Because we still holiday in. So allow yourself to, yes, you want to enjoy the holiday, but still you want to enjoy it with moderation, and still so that you don't lose sight of all of the health and wellness goals that you may have set in 2024. And if you haven't said anything for 2024, allow 2025 to be that year where you can start and track your progress and make your way towards
Thank you so much. We appreciate it.
This is it. This is our last event for the year, everybody. So we look forward to seeing you in 2025. I think we'll still see you on social media. Make sure you're following us at Equality 242. And as Khadija mentioned earlier, the recordings from the Global 16 Days campaign events are all on the YouTube channel right now, which is also Equality 242. And you can access it directly by going to tiny.cc/16days24recordings. So you can get all the recordings there. Make sure you are on the mailing list so you can keep up with us. And I think the next time we see you will be Women's Wednesdays, January 2025. So have a wonderful holiday season.